What's up, guys? I'm back for a video series. Had a little hiatus, had some technical difficulties between phones and tripods. It's all behind us now, so hopefully I can be more consistent in our discussion about just topics that come to mind, anything anybody asks about. So today I want to talk about something that I'm personally dealing with, is kind of discomfort and injuries. And got some, brachialis tendonitis going on, and it's really affecting my training. And anytime I mention this to people, the first solution is, I'll get you voodoo bands, I'll get a Theragun, I'll go get some massage done. And that's kind of typical what's going on in the fitness industry is, what little quick fix can we do? Because that's all we need. Do that and you're gonna feel way better. And unfortunately it doesn't work like that. All these little soft tissue manipulations we can do, or mobility, there really isn't any change in the muscle cell. We can get some fluid out here and there, but the brain is really the control center for this, and we can try to be tricky and we can try to do what we want, but our body knows what we need best, at least for the moment, and it's going to keep directing that stiffness, pain, inflammation, whatever, to that area until the problem is solved. And typically that problem comes from movement variability, whatever your program's giving, stress levels, nutrition, whatever it is. That's we really want to zoom out and see what's the bigger picture here. What's causing my body to think that this is an appropriate solution here. So for me personally, as I'm training strongman, I'm doing a lot of really elbow dominant exercises with not a lot of range of motions. It's the same hand positions over and over. It's the same implements. And so my variability at my wrist, my elbows, my shoulders has dropped down. In order to chase maximum performance, I had to reduce my options so I could be really good at a few of them. And the effect of that is certain joints don't like that. It doesn't have certain ranges of motion of kind of overstress them out. So does that mean I should stop doing it? Well, I probably wouldn't win any competitions if I just did everything variable at times. So there is a little bit of discomfort that comes with specificity. So, another example would be the constantly tight hip flexor person. So you see this person, my hip flexors are tight, and everyone's solution is, do a couch stretch, get a so right, get your Theragun out, or whatever it may be. But then if you really zoom out and look at them, this is somebody who only does bilateral stance exercises, especially backloading squats or deadlifts. So we have this forward hip position, and then we go and sit all day, or maybe just ride the bike. And so these constant positions where the hip flexors are shortened. So of course they're going to feel tight. Of course they're going to get stuck there, because the only stimulus we're giving them is this bilateral shortened position. So the solution, in the short term, might be some of these release tools or some stretches. But if we really want to change it long term and not have this keep coming up, we have to provide new movements that require a lengthened position, like a hip flexor. So for instance, this might be a split squat to a deficit, or from a deficit. So it forces that hip flexor to lengthen while the others shorten, and they separate. And constantly, it's going to feel really stiff at first, but that's going to require the body to have a longer hip flexor. So it's going to make those changes from the brain, not just through these soft tissue manipulations. So it doesn't mean that we should totally stop doing all these things. Foam rollers and stretching, it still feels good. And that's something you can't deny. Some people say, I feel better. And there's something good about feeling better. So you can still use these things sparingly, but we don't want to put all our chips in that basket like that's going to fix anything. We need to have a multi-dimensional approach to it. Use your short-term methods so that you feel better comfort, and then maybe we can get into exercises that actually force the movement to be opened up. So going back to my example of my elbow, I have to continue to train the way I'm training in order to maximally perform. I'm going to try to use some soft tissue work just to mitigate pain, but it's got to continue, so it can't really change. As soon as this is over, my whole idea is to expand my movement menu. So not just doing these hard elbow flexion, I have to change the hand position. I have to add in different rotations, and alternating sides would be a good one. Maybe lighter, maybe higher repetition, maybe some different isometric holds or different lengthening positions. So that's really how you solve this. Okay, I'm only doing about one thing or three things. Well, what if I start doing 10 of them equally? Then that starts to disperse. The demands change in the muscle. It has to change its function. Bones have to move around in order to, fit these new demands. And then everything's going to start to feel better. We're going to stop putting all of our attention on one specific movement pattern, and then the body starts to adapt. What's going to happen in effect is I'm probably going to get worse at the strongman events. If I'm not competing, that's fine. So you have to always balance, what am I aiming for? If it's maximum performance in one realm, then you're going to have to suck up having some discomfort there. And that's where your soft tissue work can come in and help mitigate some of that pain, but it's not going to really go anywhere. But if you're not training for something, then and you're constantly in pain, then you really have to take a step back and see how important is the things you're doing. If you're not training for a specific goal and you just want to be healthy, then a variable program, and another tool is having a high motor, having a lot of capacity. Aerobic base really allows us to tone down and recover, but it also raises our threshold for injury. The bigger the motor, the less likely you're going to get hurt doing low-level stuff. So if you're having discomfort, you can use your tools, use them in the beginning. If it makes you feel better, then definitely use them. But then you have to get into a program, or get into some exercises that force ranges of motion, force adaptations that you're not doing, and continue with those. And then also throwing in some aerobic capacity work to just increase your motor size. And really that also brings down the intensity of the workout. So I hope this didn't scare you away from using your mobility tools. They can be effective in certain formats, but again, it's not our long-term solution. Zoom out, look at the bigger picture, look at the things that you're missing in your movement patterns and your programming and your daily life. And if you can add more options there, then you're going to see a lot of these issues kind of fade out. So I hope that was helpful. I'm open for new suggestions. If you have anything you want to talk about, I'm here. I will add to it. I had some people asking for a snatch video. It's going to have to wait until my elbow feels a little better, so I apologize. But anything else, I will gladly go over and chat. Otherwise, I'll be back next week rambling, which is something I'm really good at. I've never had any trouble talking. So we'll catch you guys next time.